Hi everyone, my name is Frankie Crognale. I'm 18 years old and I'm a freshman at LAM College. When I lived in Pennsylvania, I worked in retail for about 2 years, and it's the absolute best feeling in the world to have a child walk up to you and ask you what's wrong with your face. They're usually referring to the dry patches on my forehead, eyebrows, nose, ears, and neck. These are patches of psoriasis. I've had psoriasis since I was about 10 years old, so it's been around 8 years now, almost 9. Psoriasis is a completely normal skin condition, and it's nothing to be afraid of. You're probably asking yourself what psoriasis is, what causes it, and if there's a way to get rid of it, and that's what I'm here to tell you today. The 2016 version of the Center for Disease Control's definition for psoriasis describes it as patches of thick red skin and silvery scales. These patches can occur mostly anywhere on the body. For instance, mine started in my scalp, then moved behind my ears. It then began on my arms, my chest, and slowly moved down to my stomach and my legs. I'm absolutely covered in it, and I'm always scratching it. It does itch and it does flake off, and sometimes if it's scratched a little bit too hard, the patches will bleed. One of the most common questions I always get is, does it hurt? The answer is no, it doesn't physically ache, but on some days where the air is very cold, the patches will crack and bleed, which is very painful. According to a recent study conducted by the National Psoriasis Foundation in 2012, psoriasis affects about 7.5 million people in the United States, so it is a very common skin condition. Some have it a lot worse than others, mine being one of the more severe cases. This information is shown on the graph provided by the NPF. Now that you know what psoriasis is, let's move on to what causes it. Psoriasis is an autoimmune disease, which basically means your body is attacking itself from within. In my case, my body is making more cells than it actually needs, and the patches on my skin are my body's way of disposing the cells. Other possible causes are genes, stress, and anxiety. I can attest to this, as I normally experience the worst flare-ups during stressful or anxious times. My grandfather also had it, which is another possible cause of my case. The second most common question I get asked is, will I ever get rid of it? The answer is no, yet again. Psoriasis is incurable and it is chronic, which means it will be with me for an extended period of time. According to a group of medical professionals at the National Psoriasis Foundation and at the National Institutes of Health, there is no real treatment for psoriasis. There are only ways to control it. There are topical solutions, which are various lotions, creams, and ointments one can put onto the skin every night to help with the visible patches. The next possible treatment option is oral medications. These oral medications are called immune system suppressants. Immune system suppressants do exactly as they say. They suppress your immune system, which can make you more susceptible to sicknesses and infections. The last treatment option, normally offered by doctors, is UV light therapy, or ultraviolet light therapy. UV light therapy is when you go into a doctor's office and get specially concentrated doses of UV light shined onto your psoriasis. A more natural alternative to that is simply tanning, which is why most psoriasis patients move to Florida so they can have the sun all year round. In 2014, the National Psoriasis Foundation teamed up with medical professionals at the American Academy of Dermatology and found that another possible way to control psoriasis is by changing your diet. You can begin this change by cutting out gluten or dairy. A 2010 study in the Journal of Clinical Laboratory Analysis found that psoriasis patients with the HLA-CW6 gene, a gene linked to psoriasis, had an increased sensitivity to the gliadin protein, which is gluten. Dairy is considered to be bad for psoriasis patients as well, as dairy naturally causes your body to create more cells. This is the exact opposite of what a psoriasis patient want, as the body is already creating too many cells for its own good. Supplements are also encouraged, such as probiotics, turmeric, and sodium bicarbonate, all of which are supposed to help with inflammation, and all of which I do take myself. To conclude all of this, psoriasis is absolutely nothing to be afraid of. It isn't contagious, and it's completely normal. It is an autoimmune disease, which means it's internal and cannot be treated, and it's not contagious. It can be caused by genetics, stress, anxiety, or poor diet. There are ways to control it, but not ways to cure it. Now that you know what psoriasis is, what causes it, and how to treat it, I hope you will educate your friends and family on this skin condition. Thank you so much for your time. I'm Frankie Crognale.